Hi, my name is Michelle. I'm the physiotechnician here in Windsor for Berkshire Healthcare Foundation Trust.
Hi, my name is Amar Hussain and I am a dietetic assistant and I work for Frimley Health.
My name's Rebecca. I'm an occupational therapy assistant and I work in the integrated care team within Optalis.
At Windsor here, you can obviously get into town quite easily for the shopping. There's beautiful walks down by the river and you've got the long mile walk by the castle.
So I've got a young family. We enjoy going for walks. There's lots of great places to have local walks, lots of great parks. You've got cinemas, lots of places to eat, bowling and some great pubs and clubs locally as well.
So Frimley is quite next to the heart of Camberley, and I think Camberley has so many things to do. For example, it has great shopping outlets in Camberley Town Centre. I also like going to the Frimley Lodge for a walk, sometimes on the weekend. And I like the atmosphere of the hospital itself, so just when I'm at work, I think it's one of the best things that I do is to be at this hospital and be on these premises.
I really enjoy the variety of being able to work from home but also work in the office. I think it's fantastic to be able to still see people, especially after COVID and the pandemic, to be able to physically go in the office and see other people with other teams.
The classes that we run here are now back doing face-to-face, so it's lovely seeing the patients interact with each other, giving each other kind of advice and kind of motivating each other, and we often swap recipe ideas as well.
I think taking one name would be unjust for the whole department. I think the whole department works really well as a team, and I've been supported by many department members in different scenarios. So for example, for anything that was admin related, I appreciate and I have been supported by Emma. For anything that has been stock related, I've been supported and helped by Ruklani, who I have replaced. And my colleague Steph has been a key member of the team who has shown me how the role works and how to work my way around. And nonetheless, Lauren Turner, who has kind of given me the opportunity to be with the team and to be with the best healthcare professionals who are kind of making an impact in patient care and patient support.
Really, my whole team have been incredibly supportive. They're all seniors and they're all very experienced in their profession. Specifically, my line manager Diane, who's the OT within our team. She's been very supportive and has allowed me to shadow her very closely and taught me a lot.
I've always wanted to be a physio, but struggled through various educational kind of routes. The last couple of years, the apprenticeship route has started, so I've now 2 years into that, 2 years to go where I'll hopefully be a fully fledged physiotherapist, and then hope to continue to work here for Berkshire Healthcare.
I think I've learned a lot about other roles within healthcare. So I work closely with mental health practitioners, community matrons and social workers. And I've learnt that that can really overlap. So my job role doesn't end just there.
All of the dietitians are inspiration, but I think I'm most inspired by Emma as she works close to kids. In my previous roles, volunteered and worked as close to kids as Emma is. So she inspires me in terms of being able to play a part in the PEDS dietetics. Also, Lauren Turner, who's also the lead dietitian, she's an inspiration because the way she manages things, the way she has that magic, it's just helping the department go forward. So it's just an inspiration. I think I'm learning from each and every person at my pace. So it might not be just, again, to say one particular name, but these two people are my inspiration so far at the department.
I'm always inspired by the patients that kind of put in the effort and they come in and you can see that they feel more confident after they've done their exercises, they're able to do more things. They're really pleased with what they've achieved.
I'm about to start an apprenticeship programme this September to become a qualified occupational therapist, so I'm really excited to undertake that and hopefully become qualified at the end of it and open up many more doors.
As I'm hoping to become a physio soon, I've still got a few more placements to go, so I'm still excited to kind of see where my journey takes me. I currently work in MSK physio, which I love, but I haven't explored a few other departments, so I'm looking forward to see where I might go. Very early on in my career, we had an away day where we had loads of different departments come and talk about what they did. And I always remember the head of podiatry coming in and saying no matter what is going on with their feet, making sure their footwear is essential, making sure it's good footwear. So I always pass that knowledge on to my patients, no matter what they've come in with. I kind of just have a quick glance at their shoes, pass that little bit extra on. So obviously we have to talk about physiotherapy benefits. It's really helpful to know a little bit about a lot of other services so we can pass that on too.
I have managed and I've been managed by various people, and I think so far that the learning experience that has most inspired me is how uniform and protocoled the actual methodology here at Frimley is for any task or any medical intervention.
So when I first started, I had a brilliant induction with my line manager and my team. I was able to shadow the other professionals out on visits, which taught me a lot, how to manage some difficult situations, what questions to ask. The training's been ongoing, so I do a lot of online learning as well. But daily I'm learning from my team and from the different scenarios that come to us.